Hello, all. I am Sean Prater, and this is Topic 5 Cyber Threats and Attack Vector presentation. So, we begin with, as we discussed in the previous presentation, cyber criminals and insider threats are the greatest threats to a large hospital, and they aim to accomplish that attack by utilizing ransomware and phishing techniques. And we can't forget about insider actors and their significant role that they play in a large hospital. So, some of the system attacks cyber criminals and insider threats can perform, beginning with cyber criminals ransomware. Ransomware blocks access to a hospital's network and potentially can expose medical information, interrupt medical systems, and put patients at risk. Also, phishing attacks are exceptionally dangerous for healthcare organizations because patient data is one of the most valuable assets for criminals today. So PHI, or better yet, protected health information, is worth a fortune to cyber criminals. And then when we speak on insider threats, physical sabotage of a hospital's equipment, and the potential act of an insider threat disclosing any sensitive data to any unauthorized entities outside of the hospital can also be very dangerous for a hospital. Now, the difference between a threat and a vulnerability. A threat exploits a vulnerability and can damage or destroy an asset, whereas a vulnerability refers to a weakness in your hardware, software, or hospital procedures. In other words, it's a way hackers could easily find their way into your system. And below on the slide, there's a list of examples. Now, some of the possible attacks these actors can perform, beginning with cyber criminals and the least serious attacks. We could begin with cyber stalking. You know, a patient or former patient, a visitor, or whoever it may be, could be just stalking some of the employees' social media, and also phishing emails. Just hackers randomly sending emails trying to see what they can get from someone within the organization. And insider threat, least serious attacks. One would be accidental. An employee, a nurse, inadvertently drops files too often, or a careless employee who just constantly has negligent, dangerous behavior. Talk too loud, or talk on the phone about a patient's information, or the status of a patient, whatever. Those are some tendencies to have some less serious threats. And now, as we transition into most serious threats, we'll begin with insider threats. An intentional insider threat is someone who abuses their access to the hospital, their privileged access, and typically will try to steal information for financial or personal incentives. And then we also have mole. A mole is an imposter who is technically outside the hospital network, but has managed to gain insider access to a privileged network. And then cyber criminals. Most serious attack would be a data breach. So a data breach by a cyber criminal would be using malware to find a vulnerability to pave a way into full access of private data, which may include patient names, date of birth, or a social security number. And then a more dangerous phishing email, constantly sending them over and over again, trying to get someone to bite, and could lead to inadvertently allowing these attackers into your network. There's a list of references, and thank you for your time today.